The way that you use hyaluronic acid fillers is you go very, very superficially into the skin and you do the most minute little aliquots and you go up the line. Can you see that that line went away instantly? And it will last longer than collagen will. The danger is that if you overdo it, you're going to have to either express it or you're going to have to use a little hyaluronidase.
Again, minute volumes.
I mean, it is so teensy-tiny as to not be believed. She's got a sleep line. Gary Monheit loves this line. You see that right there? She really has this line. So I think it's very important to address that for youthfulness. I think that Gary alludes to this by calling it the platform. If you put too much in this platform, that's when you give people what I call the monkey look. They get this rolled look. So you want to have a very natural look. Now, I do agree that optimally, I would use a 1-inch needle when I'm doing the border for definition, but to avoid the time that it takes for changing needles, I'm just going to go ahead and take care of it with this shorter needle. And then in here, to get a little bit of improvement with that sleep line, I'm going to put a little right there. If you see that line right there, one of the keys is you must stretch it so that you can really put it exactly where you want. I tend to try to avoid having the bevel up. If you do too much, you take a little needle, and you do like this, and you squeeze it out, just like that. You can do that a day later, you can do it a month later, I think you could do it several months later. Unfortunately, the HA that lasts the longest is the HA you put in the wrong spot. So you need to know how to get rid of it. So I'm going to go this way, and I'm doing a little antegrade injection right like that, just to give her a little bit of definition. Now remember, the philosophy of this section, this little thing is, what can I do with one syringe? I want to tell you another area of caution. You see this etched line right here? The biggest mistake you can make, one of the most horrible cases I ever saw, is someone who put Perlane in that etched line. What that doctor did was it bulged this up and it made it hang over, and the patient looked 10 times worse. So this is an area where you have to go very superficially, or another technique is what Lisa and I do, which is sort of like doing it deep and doing sort of like a volumetric filling to give a little bit of a lift. But you have to be very, very careful in that area.
You can get this bulldog look.
Oh, it's horrible.
Huge jowls.
It's horrible.
You can't feel it.
And
again,
it kind of hangs there.
But again, locally, it's better not to correct it than to give it a deformity.
What I'm going to do so we don't skip it is I'm going to do her Botox, and then I'm going to finish injecting this side. What I'm trying to do is show you, I'm only going to use one syringe, but I don't want to slow Ken up. I want to show you how important it is to do the mentalis, because one of the things she hates is this line right here. You talk about a waste of Restylane or a waste of Juvederm is to put a lot of material right there. Instead, address the mentalis. It pulls this down and it softens it. So I'm going to show you where to go there. We're going to do a little in her DAO. We'll do a little here. You see that dimpling? And I like 2 injections. And I do about 2 units on each side, right there and right there. It's absolutely amazing how in about 2 weeks this is going to look better. Then the DAO, I like to address it a little bit lower. I like to feel where the muscle is. I like to put about 3 to 5 units right in there. But I also like, when possible, to extend that and do in the upper platysma. We've been doing it for a long time, but now all of a sudden it's got a name, and it's called the Nefertiti lift, because some brilliant marketing dermatologist from Belgium decided to call it something. I envy that ingenuity that they do something that everyone is doing and yet they put a name on it, don't you? But the principle is that when you get the platysma, you're going to get a natural lift. And one of the things Nancy loved was last year she got a little jawline lift, and she thought it was from the Restylane, but it really wasn't. It was from her Botox work. So I just wanted you to see, you notice how I pinched that skin up and I went right into the platysma. I did the DAO here and I did the mentalis here.